What I'd like to do today is demonstrate the use of CLX TheraBand loops in conjunction with other adjunctive therapy techniques. So we're going to take a loop at bicep extrinsic tightness. We know that we assessed our patient and know that this is more of a extracapsular restriction. Let's say if the bicep's been shortened due to internal rotation for a period of time, whether it be to a distal biceps tendon repair. So what we're going to apply is a low load stretch over a period of time, along with an instrument-assisted soft tissue mobilization technique. So again, evaluation is critical for the patient. We want to make sure that we know what we're treating. So this works best, again, with those extrinsic soft tissue restrictions. So we want to put just a little bit of pressure. We don't want to set off any neurological responses, co-contractions of the extremity, and I've seen it happen multiple times in people. So what I do is we think about this. If you're waiting for a bus to come and you're standing and someone pushes you, the first thing you do is hold your ground or push back. The same thing with the tissue. So we want to lull that tissue into feeling good and comfortable and use the right amount of pressure at the right time with our patient in order to get elongation of those soft tissue structures that we're trying to have an impact on. So what I'll do now is I'll take the CLX loop, wrap this around the extremity. So we'll go ahead and hold right here. And what I'm going to do is I'm going to use multiple instruments at the same time. As we can see with this big bottle opener here, is we have a double beveled edge, which is going to be a softer, more comfortable treatment edge. And then we can get down a little deeper with a single beveled edge. And we're going to work really from this whole kinetic chain, from the shoulder right down from the deltopectoral interval, right down to the distal and proximal biceps. And I can work right down into the forearm. So what I'll do now we have our patient positioned comfortably, and we position ourselves for success at the same time as we want to make sure to introduce this technique slowly. So what I'll do is I'll come along here, and I'm going to start to do a nice slow sweep and scan of that particular area. I could work down here into the antecubital fossa. Okay, I can use my hook to get in under that bicep tendon, either laterally or medially. And then I can work with this instrument right up into the forearm. And so now, instead of using my fingers, I'm able to use the concavity and the convexity of the instrument in order to get a nice surface area. So now I have more real estate that I have in contact with the patient. So now I'll go both directions due to the double beveled edge, work a little here and back in the opposite direction right up the chain. Now if I find a particular restriction in one particular area, what I may do is I may go to a different technique, let's say a fanning technique, where I'm going to assess a particular soft tissue restriction. Okay, and then I can move down this whole anterior line and just switch sides if I'd like to and come along. So as that soft tissue relaxes and comes into more extension, we're able to release that tissue and begin to activate it afterwards. So what happens is after we've done the treatment, we go ahead and then initiate function afterwards, because there's no sense in mobilizing something and not moving it functionally afterwards. We have to get into that, incorporating a therapeutic activity into our instrument-assisted techniques, mobilizations, or whatever we're doing, okay? And once we've done that, we can do our pre-test and post-test and document our improvements in the patient's range of motion and reduction in pain.